Thank you for staying with us on TVC News at 1. It's now time for news from the state with Adebanke Odunuyi.
Thank you, Olamide. Your continues from the states. I will bring you reports on key developments across Nigeria's 36 states. I am Adebanke Odunuyi. And we begin in Enugu State, where the House of Representatives is calling on Nigerians to maximize the use of primary health care centers as a place of first responders to serve as measures to reduce volume of cases being handled by tertiary institutions across the country. This was made public during the House of Representatives Committee on Primary Health Oversight visit to Enugu State. Senior reporter Bamidele Ajayi has details.
Constructive use of primary healthcare facilities as a first point of contact for minor ailment is a cornerstone of an efficient medical system. The major goal of using PHC for minor ailments such as malaria, minor respiratory infection, or simple skin condition is to streamline the patient flow pyramid. PHCs are designed to serve as a gatekeeping level of Medicare that stabilizes patients, serves as a resource point where major cases meant for secondary and tertiary level are referred for medical attention. At this two-day visit to Enugu, the federal lawmakers outlined steps taken by the National Assembly to improve primary health care services across the country. He emphasized the support and federal government quest to increase consolidated revenue for primary health care from 1 to 2% contribution.
We've gone around, we have seen a lot of intervention in health, and we believe that if this continues in a short while, the health system in the state will be highly transformed. We have also seen the dedicated human resource for health that you have on ground, especially managing key sector from the commissioner, the ES, and then the primary the health insurance. If there is anything regarding health that maybe they have been interacting with the state, the federal government, and the response has been appreciated, we want to work with the state to ensure that such things are addressed.
State government gives insight to the key parameters that necessitated the investment in education, health, infrastructure, industrialization, and tourism. The state government requests that concerted efforts should be deployed to assist the state to untie those bottlenecks that will accelerate growth.
But speaking quite frankly, it's important for all of us, both at subnational level, at the federal level, to find public health and health generally, find it and situate it where it should be. It should be primary in our consideration, because it's only a healthy society that is able to aspire to achieve any other goal. We are offering our hands of fellowship with your committee, because quite a lot will be needed in partnership with the federal government. Even some of the federal tertiary healthcare facilities in Enugu, like the UNTH, so many of them are here. We need to also work with you to strengthen them.
The House of Rep committee members were taking round the Type 2 hospital constructed by the state government, alongside the secondary, tertiary, and quaternary hospitals, to ascertain the state government investment in healthcare to curb medical tourism on the continent. Bamidele Ajayi, TVC News, Enugu.
Senior reporter Bamidele Ajayi joins me now to give us more information on this development. Bamidele, the House Committee is urging Nigerians to prioritize primary health care centers as first responders. Did lawmakers explain why PHCs are still underutilized across many communities in the country?
Thank you for having me. The lawmakers visit Enugu on the two-day visit with one, to ensure that the primary health funds are fully utilized and ensuring that that tier of primary health have skilled healthcare. According to some of the complaints they were that the step one, some of the cases transferred to tertiary and secondary, where cases that should be handled at the primary level, like malaria fever, infection. They were like, if the primary care system had been taken care of with upgraded facilities and infrastructure, the level of loads that tertiary will be attending and even secondary education will be less. And also, they are now advising state governors, in line with their understanding, that they're also proposing that the 1% from the budget for primary health should be increased to 50% to ensure that state governors ensure that they provide quality healthcare services at that tier, at the world level. Moving forward, when it gets to secondary and tertiary, now it's going to be serious cases that will be done on referral. From their findings, according to when they finished the tour and because they visited some selected their tertiary institution and even primary institution in the state, according to them, they were marveled by what they saw. That even in Enugu State, they have primary health care in all the words. Like I said, in all the words, in the city political words. That means each word has its own well-equipped standard, even with personnel at the ward level, so that cases that will be transferred to the tertiary and even secondary will be at least will be minimized. So they were moved. That's why they said they want to partner with the state in the area of getting donor support and ensuring that some of those support are tailored through the facilities they are targeting.
Okay, Bamdele, during the oversight visit, did the committee identify any gaps or deficiencies in Enugu's healthcare infrastructure?
The only thing I noticed that they said what the research could have been a gap was that they were expecting to see one primary health care per local government, which would be 17, that is in the state. But on getting to the local, that means local government that has 20 wards, that having 20 primary health care, with furnished with even standby personnel. According to them, they said they marveled. They were like, how is it going to be possible? Because how would the state be able to sustain? So that's why they're now looking for partnership with the structure on ground. They're also looking for a peer review that other states should copy what Enugu is doing in ensuring that that service at that level is brought closer to the grassroots. Their interest is fully utilization of the primary care fund and quality service delivery to the people at the grassroots. And that's it's a prototype that other states could emulate and copy so that Nigerians will be able to tackle some of those ailments at that tier before we're thinking of going to secondary or tertiary.
Bamdele Ajayi, senior reporter, thank you so much for joining us.